Section 16.2, we're going to give you a general overview of the type 1 allergic reactions. There's some terminology that you should know. Allergy means that you have an immune response manifested by inflammation, and it's an exaggerated immune response. It's overreacting. It's reacting to allergens, which are basically a special category of antigen that only affects allergic individuals. So it's not there's no noticeable effect in non-allergic individuals. And it has a similar physiological mechanism, immediate onset, associated with exposure to a specific antigen. So it's similar to what you have with an antigen, a typical antigen, but it's an exaggerated response to something that most people don't respond to. It's just a certain set of people. Atopy is a chronic local allergy such as asthma or hay fever, and it's something you'll live with for the rest of your life. It's not a short-lived thing. And an anaphylaxis is a systemic, sometimes fatal reaction that involves airway obstruction and circulatory collapse. Just who is affected and how much are they impacted? So allergies have a profound medical and economic impact. Your book states that nearly half of the population of the United States is affected by airborne allergies. And if you go and check the WebMD allergy statistics page, it says that over 50 million people suffer from allergies every year, and the cost to healthcare and businesses is over 18 billion with a B dollars. Lots and lots of money is spent on treating and dealing with it in businesses and just in health in general. So a predisposition to allergies has a genetic component, and it may not be allergic to the same substance, but the prospect of a child developing an allergy is 25% if one parent exhibits symptoms and 50% if both parents or if grandparents and siblings are also afflicted. So common allergens are classified by their portal of entry. How do we get them? We inhale them, so we ingest them, we inject them, and sometimes we come into just contact with them, so direct contact. So inhalants include pollen, dust, mold, spores, dander, hair, animal hair, insect parts, and formalin. So these things can cause an allergy, an allergy by just inhaling the allergen. Ingestants are something you have to eat, so food or drugs. Injectants, these are things that are injected into you. So some people have drug allergies that are when they are injected with the drug. Bee and venom from a wasp are also injectants that are very common. And contactants are ones that you come into contact with. So like latex is a really good example, heavy metals, drugs, cosmetics, dyes, and so we're seeing a lot more of this developing, and so they have different types of detergents that are dye-free. We have latex-free gloves. Cosmetics are, they're taking note and trying to make these so they're hypoallergenic. A schematic view of the cellular reactions during the type 1 allergic response. First you have the exposure, and this is in the sensitizing dose. So the sensitizing dose, you should know, does not have symptoms with it. So what's happening during this time is that you're making IgE antibodies, and those IgE antibodies are attaching to mast cells. And then the second time, and any other exposure to the allergen after the sensitization of the mast cell will create more sensitized mast cells, and it'll cause degranulation of the mast cell. And the mast cells chemicals, then the granules, will cause the different types of allergic responses, the symptoms of allergy. By traveling through the bloodstream, they'll go all over the body and cause the various symptoms all over the body. So here is an animation and shows you a little bit better what's going on.
Some people develop an allergic reaction or hypersensitivity when exposed to substances such as dust, pollens, animal dander, or penicillin. This hypersensitivity is mediated by IgE. Sensitization occurs when the antigen makes contact with some part of the body. The antigen is taken up, processed by antigen-presenting cells, and presented on a Class II MHC to T helper cells. Tissues under the mucous membranes are rich in B cells committed to IgE production, and IgE-producing cells are more abundant in persons susceptible to allergies. The T helper cells produce cytokines which stimulate these B cells to proliferate and differentiate into IgE-producing plasma cells. As IgE is produced in specific areas of the body, the IgE molecules attach via their constant regions to receptors on nearby mast cells. Mast cells contain granules packed with chemicals that induce a hypersensitivity response. Once attached, the IgE molecules can survive for many weeks. The individual is now sensitized to the antigen. When exposed to the antigen for a second time, the antigen binds to the IgE antibodies on the mast cells. To trigger a response, two cell-bound IgE molecules must react with a specific antigen. Within seconds of the reaction, the mast cell releases histamine and other mediators of the inflammatory response from the granules, triggering a variety of symptoms.
The role of mast cells and basophils in the type 1 allergic response. First of all, they are ubiquitous. They are located in virtually all organs. They're located in the connective tissue there, and so they're everywhere. They have a capacity to bind to IgE and to also degranulate. Each cell carries between 30 and 100,000 receptors for IgE, which is a lot. And it triggers whenever you have two allergens or an allergen. The receptors trigger the release of inflammatory cytokines from the cytoplasmic granules when bound by allergen-associated IgE. So the second contact with the allergen is what actually produces the symptoms. So in some books and textbooks, they call it the provocative dose. And you have your first dose, which is the sensitizing dose, and then you have the second contact. And any subsequent exposure to the allergen will create the allergic response. And so IgE primed mast cells can remain in the tissues for years after sensitization. A person retains the capacity to react immediately upon re-exposure. So just like your immune response, you have immunity to disease, you're going to have exposure. Once you've been exposed to the allergen, you're still going to react immediately to the allergen, even if you haven't been exposed to it for many years. So allergen molecules bind to adjacent receptors on the mast cell membrane and stimulate the degranulation. Chemical mediators are released into the tissues and to then the bloodstream, so it travels throughout the body, causing systemic responses. Cytokines target organs and allergic symptoms. The chemical mediators produced by mast cells and basophils include the following: histamine, which you should be fairly familiar with, serotonin, leukotriene, platelet activating factor, prostaglandins, and bradykinin. These chemical mediators can work alone or in combination, and they account for a tremendous scope of allergic symptoms. They target the skin, upper respiratory tract, gastrointestinal tract, conjunctiva, and the symptoms can include rashes, itching, redness, rhinitis, sneezing, diarrhea, and tears. The systemic targets are smooth muscle, mucous glands, and nervous tissue, so they're usually associated with some sort of autonomic response of the nervous system, and you don't have really any control over that. And the smooth muscle is one of those muscles that is under autonomic control as well. and the autonomic nervous system causes secretions in mucus glands. And so basically you don't have any control over these symptoms. It just automatically happens. The change in the activity of smooth muscle can alter blood flow, blood pressure, and respiration. Pain, anxiety, agitation, and lethargy can also be attributable to the effects of the mediators. So this picture to me is a really good idea, or shows really the different symptoms and how they're respond and what kind of chemical mediators cause these symptoms. So the three big ones, histamine, serotonin, bradykinin, will cause this wheel and flare reaction because of the dilated blood vessel. You get fluid going in and you get redness. And you have increased peristalsis caused by these chemicals in the intestine. That's going to cause diarrhea and vomiting. And in the secretory glands, you're going to have excessive mucus secretion, and so runny nose, basically, and with itchy, watery eyes. That's going to be the symptoms you're going to see there. People who have asthma have these leukotrienes that cause constriction of the bronchioles as well as airway obstruction, and mucus buildup causes that. So it's a 1-2 punch. You got both the constricted bronchioles are already constricted, but you also get the airway obstruction because of the mucus secretions. And if you have prostaglandins, they can cause dilated blood vessels, constricted bronchioles, and nerve cells can be more sensitive and cause pain, so you get a headache. And so what aspirin will do, it not only reduces fever, but it also is going to affect the prostaglandin and take away headaches. So atopic diseases, these common allergies, hay fever and asthma are two examples. And hay fever is this allergic rhinitis, so you get the runny nose from this. It's usually something that is related, we call it seasonal allergies or hay fever, because you get these when particular pollen granules are released during different seasons. And so you get them at a particular time of the year, or molds where they're more common during different times of the year. Chronic year-round reaction to a wide spectrum of airborne allergens or inhalants can also be part of this hay fever. And asthma is characterized by critical episodes of impaired breathing due to severe bronchoconstriction. So you get this severe bronchoconstriction and airways are clogged up with lots of mucus as well. And so it can happen very quickly in very minute amounts of exposure to allergens. So it doesn't take much of an allergen. You could just have exposure to peanuts at a plant that not only, you may not have peanuts in this particular thing that you're eating, but if the peanuts were used by that machine, even a tiny little peanut allergen could be present and could cause a severe asthma attack. So eczema is an atopic dermatitis as opposed to contact dermatitis, which is a type 4 hypersensitivity. Sensitization can occur through ingestion, inhaling, and occasionally skin contact. Begins in infancy, reddened, vesicular weeping, encrusted skin lesions, and it progresses through childhood and adulthood to dry, scaly, thickened skin. Food allergies, you can see they have lots of different food allergies here. Peanuts are some of the more common, fish, cow's milk, wheat, eggs, shellfish, and soybeans. And the portal of entry is obviously intestinal, you eat it. Gastrointestinal symptoms include vomiting, diarrhea, and abdominal pain, and you can have other manifestations like eczema, hives, rhinitis, asthma, and other, occasionally, anaphylaxis. So food allergies can manifest themselves in a lot of different ways, but because of the increase in peristalsis in the large intestine, you don't have as much time to reabsorb the water, and so it goes through and you get diarrhea, basically. So gastrointestinal symptoms of diarrhea. If you get diarrhea every time you eat a particular food, it may be that you're allergic to that food. Allergies to drugs are very common. Penicillin is one of the more common. Sulfa drugs are another one. Some people are allergic to aspirin and opiates, and others are allergic to contrast dye used in x-rays. So anaphylaxis is an overwhelming systemic reaction, and again, you have no response the first time you come into contact with it, but the second time you have itching, sneezing, difficulty breathing, prostration, and convulsions. And many have died within a few minutes of coming into contact with the allergen. Systemic anaphylaxis really affects this. It's a sudden respiratory and circulatory disruption that can be fatal. Some of the common ones are bee stings, and that's why they have to carry like an EpiPen around if you have an allergy you know of, allergic to bee stings. And if you have injections of antibiotics or serum, that again can cause systemic anaphylaxis. That's why when you take like a vaccination for the first time, they'll give you and watch you for a few minutes after, because if you're going to have anaphylaxis, it's going to happen very quickly after. Diagnosis of allergy, so they can do in vivo and in vitro. So in vivo would be like the scratch test. So in the skin, they'll input just tiny amounts of the allergen into the skin and then come back 15 minutes later and see where there's wheel and flare reactions, and then the skin tests can look at hundreds of different allergens at a time, and they map the skin on the inner forearms or the back. So treatment of allergy, you have a lot of different options. Sometimes you can avoid the allergen, other times you can try some desensitization, and occasionally they'll have drugs that can block the action of lymphocytes and mast cells or chemical mediators. So taking drugs to block the allergy, the aim of this is to block the progress of allergic response somewhere between IgE production and the appearance of symptoms. And so oral anti-inflammatory drugs can be helpful, but they have dangerous side effects and should not be taken for prolonged periods. Antihistamines are probably the most common thing, like Benadryl is an antihistamine that you can get over the counter, and it interferes with the histamine in particular, but there are other chemical mediators that are involved, but that's probably the most common, and sometimes that can deal with the symptoms. Epinephrine, as we said, if you have an anaphylactic, like a really serious bee allergy or some other thing, you may carry an EpiPen around. It contains epinephrine or adrenaline, which is the same thing, same chemical, and it can be used to those who are prone for anaphylactic attacks, injected or inhaled. Usually it's injected. And it reverses the constriction of the airways so that you can breathe until they can get you to the hospital and deal with the symptoms. So it gives you a little bit of extra time. More than one dose may be required because it has a short half-life, but it buys the individual time to get to the hospital and to be treated. Desensitization, this would be how you can overcome an allergy. You give small but increasing doses of the allergen, and it prevents the reactions between the allergen and the IgE and the mast cells. So you do something to degranulate a little bit at a time so that you don't have the huge symptoms, and then you become more or less sensitive to the allergen. So the theories of immunologic-based desensitization, and you can have an injection of the allergen that causes IgG antibodies to be formed instead of IgE, and the IgG antibodies will cross-link with the IgE antibodies and essentially block them or neutralize them, so that they can't get to the mast cell. And if they're not on the mast cell, then you get no degranulation. So the strategies, basically, you can block the antibodies, you can avoid the allergen, or you can try some desensitization technique. Concept check 16.2. Here are some questions See if you can answer them, and I will read them and then go over the answers. To develop an allergy, first there is a blank dose of the allergen. So the answer for that, sensitizing. So there's a sensitizing and then a provocative dose. And the sensitizing dose does not have symptoms. So second question, the fastest acting allergic mediator, and really the most profuse mediator, is what? If you said histamine, you are correct. And that was one that I didn't actually say during the video, but that is something that's in the reading. So true or false, direct or different inflammatory cytokines have different effects or have similar effects. So I love true or false questions. Actually, I hate them because there's so many ways you can answer this. So it's true that they have similar effects. They all have some sort of inflammation, but they have different effects on different tissues. And yeah, so bradykinin, serotonin, and histamine are a little different than leukotriene, and that's also different than bradykinin or prostaglandins. So they all have, you know, kind of similar but different effects. And so I would say that's true and false. So question 4, which of the following is not an atopic disease? So hay fever, definitely atopic. Food allergies actually is not considered an atopic disease, although to me it's a pretty common allergic condition. It's not considered an atopic disease. So the answer is B. Asthma and eczema are atopic diseases. So I'm not sure what qualifies it necessarily, but as a common chronic allergy is an atopic disease. Anaphylaxis is treated with blank, and that would be epinephrine. So that is the end of section 2.